Preeclampsia is a serious condition that can affect pregnant women and their babies. It causes high blood pressure and protein in the urine, and can lead to complications such as seizures, organ damage, and premature birth. Preeclampsia can be hard to diagnose because some of its symptoms are common in normal pregnancy, such as swelling, headaches, and nausea. However, early detection and treatment can help prevent severe outcomes and improve the health of both mother and baby. One way to help diagnose preeclampsia is by measuring the levels of a protein called placental growth factor, PIGF, which is produced by the placenta and reflects its health and function. PIGF is involved in the development of blood vessels that supply oxygen and nutrients to the fetus. In preeclampsia, the placenta is not working properly and produces less PIGF than normal. This leads to an imbalance between PIGF and another protein called SFLT1, which blocks the effects of PIGF and other growth factors that promote blood vessel formation. A blood test that measures the ratio between SFLT1 and PIGF can help detect early warning signs of preeclampsia by showing how well the placenta is functioning. A high ratio indicates a higher risk of developing preeclampsia or having adverse outcomes, such as fetal growth restriction, placental abruption, or stillbirth. A low ratio indicates a lower risk of these complications and suggests that the woman can be safely managed with standard antenatal care. The PIGF blood test is usually offered to women who are between 20 weeks and 35 weeks pregnant and have signs or symptoms of preeclampsia, such as high blood pressure or protein in the urine. The test can help rule out preeclampsia in women who have a low ratio, reducing unnecessary hospital admissions, interventions, and anxiety. It can also help rule in preeclampsia in women who have a high ratio, allowing for closer monitoring, timely delivery, and appropriate treatment. The PIGF blood test is a simple and non-invasive way to help diagnose preeclampsia and improve maternal and fetal outcomes. By measuring the levels of a protein that reflects placental health and function, it can provide valuable information about the risk of developing this serious condition and guide clinical decision-making. Preeclampsia is a serious condition that affects some pregnant women, especially those who have high blood pressure. It can cause complications for both the mother and the baby, such as seizures, organ damage, growth restriction, and premature birth. That's why it's important to diagnose preeclampsia early and monitor it closely. But how can doctors tell if a woman has preeclampsia or not? Sometimes the symptoms are not very clear or obvious. For example, some women may have high blood pressure but no other signs of preeclampsia, such as protein in the urine, headaches, or swelling. In these cases, doctors may not be sure if they should treat the woman as if she has preeclampsia or not. This is where a new blood test can help. The test measures the level of a protein called placental growth factor, PIGF, in the mother's blood. PIGF is produced by the placenta and helps the blood vessels grow and function properly. In women with preeclampsia, the level of PIGF is usually low because the placenta is not working well. The PIGF test can help doctors rule out preeclampsia in women who have high blood pressure but no other symptoms. If the PIGF level is high, it means that the woman is unlikely to have preeclampsia and can continue with her normal antenatal care. If the PIGF level is low, it means that the woman may have preeclampsia and needs closer monitoring and treatment. By using the PIGF test, doctors can reduce unnecessary hospitalizations, interventions, and preterm deliveries for women who do not have preeclampsia. They can also identify those who do have preeclampsia and provide them with appropriate care to prevent complications. The PIGF test can help improve the outcomes and safety of both mothers and babies.